What are the stages of diabetic retinopathy? To make it easy for you, there are 6 stages. Number 1 is the very early stage called mild npdr. npdr stands for non-proliferative diabetic retinopathy. In this stage, you find a few microaneurysms on the retina, a few dot and blot hemorrhages. What are these microaneurysms? They're small little pouches on the blood vessels which leak. They can leak cholesterol onto the retina. And this is a very early stage. It does not require any treatment. You just need to control your blood sugar well. Number 2, the second stage is moderate NPDR. In this stage, you have a lot more of these hemorrhages all over the retina, a lot more leakage of cholesterol onto the retina, what we call hard exudates, and you can see something called cotton wool spots, which are ischemic areas on the retina. Stage 3 is severe NPDR. In this stage, the outer retina does not receive enough blood flow, and you can make out it is getting compromised. By this stage, something called irmas form all over the retina, and the blood flow, as I said, is very much compromised. Stage 4 is when you start seeing new vessels grow over the retina. They can grow over the optic nerve, they can grow elsewhere on the retina. We call this NVD and NVE, which is neovascularization of the disc, neovascularization elsewhere. This is a very dangerous stage. If you have reached this stage, it means by now the blood flow to your optic nerve and your retina is highly compromised. These new vessels have grown as a compensation for lack of blood flow. But these new vessels are very fragile and they are not at all good. What happens is, because they're so fragile, they can break and bleed, which causes the next stage, stage 5, vitreous hemorrhage. Bleeding happens within the vitreous cavity, which is the gel inside the eye called the vitreous. Bleeding happens within that, and eventually this vitreous starts pulling away from the retina. Lots of membranes are seen on the retina, and the vitreous pulls away these membranes. And this leads to the next stage, stage 6, which is tractional retinal detachment. This is the last stage of diabetic retinopathy. If you have reached this stage, it means you have simply not been tested and treated earlier. Tractional retinal detachment is a very unfortunate stage to have your retina in, because you will need surgery, you will need probably injection of oil inside the eye, and then only it can be treated. And again, there are some stages of tractional detachment which are almost inoperable.